Okay, students, good morning. Can you hear me and see the slides?
Yes, sir.
Okay.
Yes, sir.
Yes, sir.
Okay,
Yes,
thank
sir.
you. So in our last class, we have discussed how to test a peripheral nerve, right? How to test a peripheral nerve. We had classified neuropathy. Neuropathy in terms of axonal neuropathy and demyelinating neuropathy. So these are peripheral nerves, and those are very easy to test. So once you put electrodes onto your arms, and you can test the sensory nerves and motor nerves. Either you can be testing on your superior extremity or your inferior extremity. So there are lots of peripheral nerves like median nerve, ulnar nerve, and inferior extremity, common peroneal nerve, tibial nerve, sural nerve. So all these nerves we can test whether they are sensory or motor, depending on that, or depending on axonal neuropathy or demyelinating neuropathy. But the biggest challenge was how to test those autonomic nerves. The autonomic nerves, those are situated quite interior into our body. They regulate our heart rate, and they regulate, bladder and bowel function, and also to some extent sweating and many other autonomic functions. Right? Okay. So today we will be discussing autonomic function test, and autonomic function, autonomic nervous system comes also under the peripheral nervous system, and it has got two components. One is sympathetic system and another is parasympathetic system. Right. So as I am dealing with cardiovascular system, the focus will be cardiovascular autonomic function test. But here we will be doing. We are in a holistic approach, and we will be discussing autonomic function test as a whole. And regarding peripheral neuropathy and nerve conduction study, it was not a topic under cardiovascular system, but still I had taken a class on peripheral neuropathy and testing of peripheral nerves, that is nerve conduction studies or nerve conduction velocity testing. It was because to maintain the continuity, once you know the testing of peripheral nerve, and then you will be knowing how to test the autonomic nerves, right? Okay, so this was my purpose, and also the practical topic of peripheral nerve testing, that is nerve conduction velocity, is included in your syllabus. So that's why, even if it is included in nervous system, I had taken the class, but it was not included in cardiovascular system. But today's topic is included in cardiovascular system, autonomic function test. And again, it is also a practical topic, but this practical topic is again a demonstration topic. You don't need to perform autonomic function test during your examination, but you will face lots of questions on autonomic function test. Okay. Now I'll proceed. So first, learning objectives. You will perform, you will not perform, but you will know how to perform the autonomic function test in the given subject or in simulation. To examine the autonomic function test is the aim. And autonomic function test, it is the portion of the nervous system that controls most of the visceral functions, right? Most of the visceral functions are controlled by autonomic function. So autonomic nervous system, they control your arterial blood pressure, your GI motility and secretion, your urinary bladder emptying, sweating, body temperature. All these things are contributed by your autonomic nervous system, right? So there are a few features of autonomic nervous system which you need to remember. So first is rapid and intense. The function of autonomic nervous system is rapid and intense, and centers in the spinal cord, brainstem, or hypothalamus. They operate through visceral reflexes. Okay, so just for example, micturition reflex, right? So they operate through visceral reflexes. Efferent innervates the organ through parasympathetic and sympathetic subdivisions. Okay, so the sensory nerve will be same as that of other reflexes, but the motor component here will be either sympathetic or parasympathetic. So efferent innervates the organs through either sympathetic system or parasympathetic system, or both. right? Most of the organs having dual innervation. That means both sympathetic and parasympathetic innervation. Just say, for example, heart. Heart is having both sympathetic and parasympathetic innervations. And the most important feature is the balance, right? Most important feature is the balance. The balance between sympathetic and parasympathetic subdivision is regulated on daily basis, moment to moment, by afferent inputs, right? So for example, your heart has got both parasympathetic and sympathetic supply, right? Parasympathetic system, it reduces heart rate, and sympathetic system, it increases your heart rate. So always there is a balance between sympathetic and parasympathetic uh, innervations, right? And this balance is definitely required for maintaining a healthy life, because once someone suffers from autonomic neuropathy, say for example, usually very commonly the parasympathetic fibers are damaged, so that there is sympathetic overactivity, right? So say for example, a situation of chronic stress, or a case of diabetic neuropathy. So in our previous class we have discussed diabetic neuropathy, where peripheral nerves are damaged, and to start with it is usually an axonal neuropathy, right? To start with it is an axonal neuropathy. Yes, any issue?
ডায়াবেটিক নিউরোপ্যাথিটা স্টার্ট উইথ হচ্ছে axonal, পরে demyelinated হয়ে যাবে তো?
Yes. So to start with, diabetic neuropathy is axonal neuropathy, but for a long-standing diabetes, we may get both axonal neuropathy and demyelinating neuropathy, and also some autonomic disturbances. So if you remember, the classification, of nerve fibers according to Erlangers and Grasser. So first is A, then B and C. Under A we have A alpha, A beta, A gamma, and A delta. A alpha is both motor and sensory, so it can be a motor fiber or it can be a proprioception. Okay, proprioception carrying nerve fibers. A beta is for pressure sensation, so it is purely sensory. A alpha is both motor and sensory or mixed nerve. Okay. A gamma is gamma motor neuron. Okay, gamma motor neuron, and it is always motor, purely motor. A delta is for pain sensation, right? And B and C, these are autonomic, and C is also sensory for pain sensation, right?
Myelinated.
And completely demyelinated. So as you know that autonomic fibers are B and C, they are mostly least myelinated and or unmyelinated. Correct. So B and C are included under autonomic. So from this concept, you very easily know that as because autonomic neuropathy, right? Autonomic neuropathy involves B and C fibers. Sorry. As because autonomic neuropathy, it involves B and C fibers, right? And as you know that B and C are either completely unmyelinated or very least myelinated. So most of the autonomic neuropathies will be of axonal neuropathy variant, but definitely we can't place an electrode directly on the surface of nerve, and we can test for axonal neuropathy or demyelinating neuropathy. But as because B and C fibers are related to autonomic functions and they are not myelinated or least myelinated, most of the autonomic neuropathies will be of axonal variety. Moving on. Okay. Now, what are the autonomic function tests? So unlike peripheral neuropathy, where we place electrode on the surface, on the skin surface, and we test the motor nerves and the sensory nerves on your limbs, there are classical autonomic function tests where we don't need any electrodes. So there are few tests for sympathetic components and there are few tests for parasympathetic component. So test for sympathetic component is the postural challenge test, BP response to standing, what you have already done during your practical.
Postural
Next,
hypotension.
yes, postural hypotension, will be coming to it. Second is the head up tilt test, which is heart rate response to passive tilting. Third is sustained hand grip test, which is done by an equipment which is called hand grip dynamometer. Next is cold pressure test. And the test for parasympathetic component are basal HRV, heart rate variability. Okay, HRV is a very important component for testing your parasympathetic component of autonomic nervous system. And nowadays, we can perform heart rate variability simply with the help of an ECG machine. Some of the computerized ECG machines are very well equipped for performing this very simple test, HRV or heart rate variability. Next is Valsalva ratio. Third, for parasympathetic component is heart rate variation with respiration, which is also called EI ratio. Expiration is to inspiration ratio. And then the next is 30:15 ratio, or heart rate response to standing. So these are the four classical tests for autonomic nervous system testing, which you need to remember. And there are some other tests as well. So these tests, the other tests, which are quite modern, and nowadays these tests are evolving. But this test, to perform this test, we need a very sophisticated instrument. So first, just remember the name, and you don't need to know the procedures. So first is sympathetic skin response, then QSART, or quantitative pseudomotor axon reflex test, and second is vasomotor test, which is laser Doppler velocimetry for skin blood flow. So these are nowadays these tests are evolving, and these tests are only available in very high level of setups. But the classical tests which we commonly perform for autonomic nervous system, you need to know all this at your level right now. Okay, and just remember the modern test, which is sweat test and vasomotor test. Okay, moving on. First is the postural challenge test, or BP response to standing. So to assess it is done to assess the integrity of the sympathetic system. So first, the subject will be taking 5 minutes of rest in supine position. Now the basal blood pressure will be recording. Basal blood pressure will be taken. Simply, you have already performed. So I'm moving first. And the subject is instructed to stand up without support and remain such for 2 minutes, and BP recorded again. So this is the procedure. So what is the mechanism? You already know. So once standing, there will be gravitational pooling of blood in the inferior extremity. As a result, there will be reduced venous return and decreased systolic and diastolic pressure. Baroreceptors will be stimulated. Baroreceptors will be practically less stimulated because, as the mean arterial blood pressure is falling, right? So there will be less stretch on the baroreceptors. So baroreceptors will be less stimulated, and there will be sympathetic overactivity, right? Sympathetic overactivity, and BP returns to normal in 15 seconds. And what is abnormal? Fall in systolic blood pressure more than 30 millimeter of mercury, and diastolic blood pressure more than 10 millimeter of mercury, right? So first of all, BP is not returning to normal, and fall is more than 30 millimeter of mercury. So systolic blood pressure should not fall more than 30 millimeter of mercury, and diastolic blood pressure should not fall more than 10 millimeter of mercury. If it happens, we call it orthostatic hypotension. That means once baroreceptor is acting and baroreceptor is stimulating the sympathetic system. Okay. Now, once your sympathetic nerve fibers are damaged, this restoration of mean arterial pressure due to sympathetic activity and subsequently vasoconstriction, it is not happening due to damage to the sympathetic fibers. Whatever may be the reason, it may be the damage to the axons and damage to the myelin sheath, right? Okay, so once sympathetic system is damaged, you get the situation called orthostatic hypotension. Even if baroreceptors are stimulated, it is unable to stimulate the sympathetic system. Okay, so it is orthostatic hypotension. So simply it is a test for sympathetic system. Now head up tilt test to assess heart rate response to passive tilting. Again, we are testing this for sympathetic function to assess mainly the sympathetic function. So apparatus which is required is tilt table, ECG and NIBP. So before I proceed, I must tell you one thing that during testing postural challenge test or BP response to standing, there is a drawback which very frequently your examiner asks you during examination. So what is the drawback in postural challenge test? So ideally, what should happen once someone stands? Once someone stands, there will be gravitational pulling of blood in the lower extremity. Okay, it should happen. There should happen a gravitational pulling in the lower extremity. But one big drawback is there. That is, once you are standing, so it is some sort of exercise, and your leg muscles, particularly soleus, okay, particularly soleus, gastrocnemius, all these muscles, they pump blood, right? Suddenly they pump blood upwards, and the pulling of blood in the lower extremities, sometimes it doesn't happen. So this is the biggest drawback of this test called postural challenge test, because standing is somewhat, it can be related to performing an exercise, and as because your soleus muscle and gastrocnemius muscle, they pump blood upwards, this gravitational pulling, it doesn't happen effectively, right? So to overcome this drawback, we have this test called head up tilt test. So to perform this test, what are the apparatus required? Apparatus required is a tilt table, ECG, and non-invasive blood pressure monitoring. So the procedure is subject relaxes supine on a tilt table for 10 minutes with continuous ECG and non-invasive blood pressure. NIBP is non-invasive blood pressure, right? I used abbreviation over here. So non-invasive blood pressure. Baseline heart rate and blood pressure, all these things are measured. Now position the head side of the tilt table to an inclination of 80 degree from the horizontal. Okay, so simply a person lies on a table. Okay, simply a person lies on a table, and the person is fixed. Okay, the person is fixed with the table. Now we can tilt this table, right? We can tilt this table so that due to active standing, we can avoid the exercise. Okay, we can avoid the pumping of blood by soleus or gastrocnemius upwards. So this is the function of the tilt table. So to perform the heart rate response or blood pressure response on standing, we will require a tilt table. Okay, so position. We move the tilt table and position the head side of the tilt table to an inclination of 80 degree from the horizontal, and immediately we record the heart rate and blood pressure. Then after 1 minute interval for a period of 3 minutes. Getting my point? So in this test, definitely there will be gravitational pulling of blood into the lower extremity. Even if it doesn't happen during standing. Yes? Okay, tilt table is simply a table where we can fix the patient. Okay, tilt table is simply a table. Okay, this is a table. We can fix the patient. We can clip the patient's leg and patient's hand. Okay, and we can also clip the patient's head, right? So that the patient doesn't fall, and we can tilt the table. We can tilt the table to a particular angle, whatever angle we require, we can tilt the table. Okay, so in previous test, that is postural challenge test, we ask the patient to stand, and standing from supine position, we can compare it with exercise, right? So what muscle is exercising? Your gastrocnemius, soleus, these muscles are exercising, right? So once these muscles are contracting actively, they can pump blood upwards. So what we expect on standing, the gravitational pulling of blood in lower extremity, it may not happen, right? It may not happen when the patient actively stands. This gravitational pulling of blood may not happen, right? So to overcome this, we perform head up tilt test, and for head up tilt test we require a tilt table where we can fix the patient on the table and we can rotate or we can incline the table to a particular degree, whatever we require. Okay, so in this experiment, inclination is 80 degree from the horizontal, not exactly 90 degree. So passively we are moving the patient, and patient is not actively standing. Passively we are making the patient standing, right?
স্যার
So that, yes,
স্যার এই টপিকটা প্র্যাকটিক্যালের তো না থিওরিতেও আসবে?
না এটা প্র্যাকটিক্যাল টপিক, ঠিক আছে, এটা প্র্যাকটিক্যাল টপিক। থিওরিতে কিছু জিনিস আছে আমি বলে দেবো এট দি এন্ড অফ দিস ক্লাস।
ঠিক আছে, ওকে
ওকে, তো এই ব্যাপারটা বোঝা গেছে কি? আর ইউ গেটিং দিস?
হ্যাঁ স্যার বুঝছি
পেশেন্ট
স্যার।
অ্যাক্টিভলি স্ট্যান্ড করছে না, রাইট? পেশেন্ট ইজ নট অ্যাক্টিভলি স্ট্যান্ডিং, বাট উই আর মেকিং দ্য পেশেন্ট স্ট্যান্ডিং প্যাসিভলি, রাইট?
হ্যাঁ স্যার।
Okay, then immediately record heart rate and blood pressure at 1 minute interval for a period of 3 minutes. Again, the mechanism is changing the position of the tilt table, head up tilt, pulling of 30% of venous blood into the peripheral circulation, particularly your inferior extremity, right? 30% of blood is moving to your inferior extremity, so cardiac filling pressure, stroke volume decreased by 40%. Heart rate rises immediately due to withdrawal of sympathetic activity and due to increased sympathetic activity, right? Okay, multisystem atrophy, unexplained recurrent syncope. Just you may not remember these things. So this is a test. This is particularly a test for sympathetic. We test it for sympathetic system. It is a test more for sympathetic system than parasympathetic system. So again, what receptor is acting here? Baroreceptors. Baroreceptors are acting over here, and baroreceptor will stimulate the sympathetic system. And once it doesn't happen, heart rate should rise immediately due to withdrawal of parasympathetic activity and due to increased sympathetic activity, and it may not happen due to sympathetic fiber damage. Okay, now sustained hand grip test, diastolic blood pressure and heart rate response. So again, basal blood pressure and heart rate are recorded, and the subject is asked to grip the hand grip dynamometer maximally with his dominant hand. 3 successive trials are given, and the highest value of 3 contraction is taken at maximum voluntary contraction. Hand grip dynamometer is maintained steadily at, okay, so before that, I need to switch on the video. Everyone can see the video?
Yes sir.
Yes, sir.
Okay.
Yes, sir.
So see, this equipment is called hand grip dynamometer, right? This equipment is called hand grip dynamometer, and you have graduation from 0 to 50 kgs, right? 0 to 50 kgs, we have graduations, right? 0 to 50 kgs. First, what I'll do, so you see the arm is at 0, right? The pointer is at 0, correct? The pointer is at 0. Okay, now with my dominant hand, right, with my dominant hand, I will pull it with maximum force, right? I will pull it with maximum force, and I will see how much tension or how much force I can generate with this. Okay, so in this way, clear? Okay, let me perform it. Okay, see this? So it is 45 kgs, right? So you need to perform it in this way. You need to perform it in this way. Okay, so the maximum maximum force I can generate is 45 kg. Clear, everyone?
Yes, sir.
Yes, sir.
Okay.
Yes, sir.
Okay, so this simple equipment is called hand grip dynamometer. Once we begin our offline class, we have this equipment in physiology department, so you can come over here and perform it yourself, right?
স্যার কারো যদি 50-এর বেশি হয়ে যায়
হতেই পারে আমি এটা দেখালাম করে তোমাদের পারফর্মের, ঠিক আছে? ইউজুয়ালি মানে পসিবিলিটি কম, মানে এটা খুব টাইট, ঠিক আছে?
ওকে
হ্যাঁ, আর
এটা
এটা
লাস্ট
ডমিনেন্ট।
অবধি গিয়ে আবার স্টপ হয়ে যাবে।
হ্যাঁ, অর্ণব বোধহয় করতে পারে 50-এর উপর, জানি না, যাই হোক। ওকে, okay, so the simple equipment is called hand grip dynamometer, and now let's see how we perform this test, hand grip dynamometer. Okay. Okay, sustained hand grip test with the help of hand grip dynamometer. It is the test for diastolic blood pressure and heart rate response. First, basal blood pressure and heart rate is recorded. Now, the subject is asked to grip the hand grip dynamometer maximally with his dominant hand. Remember, dominant hand, and 3 successive trials are taken, and the highest value will be taken, right? So, say for example, I have performed 45 kgs, 42 kgs, and 40 kgs. So, I'll be taking 45 kg. Okay, so this is my maximum force I can generate, right? 45 kgs. Okay, now next, hand grip dynamometer is maintained steadily at 30% of maximum voluntary contraction. Okay, so my maximum voluntary contraction is 30%, sorry, 45 kg. Now 30% of 45 kg, say for example 45 का 30% कितना होता है? 17 kg होता है almost, ठीक है? So hand grip dynamometer, I will maintain the hand grip dynamometer steadily at 30% of my maximum voluntary contraction, that is 17 kg, as long as possible for a period of 2 minutes. Okay. So आप पेशेंट को क्या बताओगे? फर्स्ट ऑफ ऑल हैंड ग्रिप डायनामोमीटर में मैक्सिमम फोर्स जनरेट करना है. से फॉर एग्जांपल इट इज 45 kg. नाउ यू विल आस्क द पेशेंट टू मेंटेन 30% of maximum force, that is 17 kg. You will ask the patient to maintain 30% of maximum contraction, that is 17 kg in my case, for a period of 2 minutes. Okay, clear? Now you will record the blood pressure and heart rate every minute in the contralateral arm. Remember, not in the same arm with which the patient is performing hand grip dynamometer test. Clear? Okay, normal response is increase in diastolic blood pressure for more than 15 millimeter of mercury and rise of heart rate by 30% from baseline, because baseline heart rate you have already recorded. Yes, baseline heart rate you have already recorded, and the normal response is increase in diastolic blood pressure more than 15 millimeter of mercury and rise of heart rate by 30%. Okay, this is the normal response, and it is a test for sympathetic system. What is the mechanism? Rise in diastolic blood pressure purely due to increased sympathetic activity, because you are exercising, simply you are exercising, and rise in heart rate due to decreased parasympathetic and increased sympathetic activity. And remember, this response do not change with age. So for any age you can perform this experiment. Right, say for example, commonly, for example, a case of long-standing diabetes, and you want to perform how much the autonomic fibers are affected. So simply you perform the hand grip dynamometer test and you record diastolic blood pressure and heart rate. And remember, it is not our mercury sphygmomanometer or dial type aneroid sphygmomanometer. We do not use these equipments for this examination, because we need continuous blood pressure monitoring device, right? Non-invasive continuous blood pressure monitoring device. You just tie the cuff onto patient's contralateral arm, and the machine will continuously record patient's BP, so that during the performance, and also during the performance of the maneuver, and also after the maneuver, you get the record of patient's systolic blood pressure, diastolic blood pressure, heart rate, and all the parameters. Okay, clear everyone? Is hand grip dynamometer testing clear to you, so that I can proceed to the next test?
Yes,
Okay. Now, cold pressure test. Again, basal blood pressure is recorded, and the subject is asked to place hand in cold water for 2 minutes, and the cold water will be 4 degrees centigrade. And blood pressure is recorded in the contralateral arm immediately after placing the hand in cold water, and thereafter every 30 minutes until BP returns to pre-test level, right? And maximum increase in systolic blood pressure and diastolic blood pressure is recorded. Normal response is increase in systolic blood pressure by 20 millimeter of mercury. Cold pressure test. What is the mechanism? The afferent limb of reflex path is somatic fiber, and the efferent limb is sympathetic fiber. So this test is classical test for sympathetic function, right? Okay, so we can't say that a particular, say, increase in 20 millimeter of mercury. This is for adult value only. Increase in systolic blood pressure for 20 millimeter of mercury, and increase in diastolic blood pressure for 10 millimeter of mercury. This is for a standard adult, but it varies with age, so it requires standardization for age and gender. Clear, everyone?
yes, sir.
Yes, sir.
Okay. Now, a very important part in autonomic function testing, that is HRV. Okay. Heart rate variability. Basal heart rate variability. So make the subject lie down for 5 minutes, and lead to ECG is recorded for 1 minute, right? The maximum and minimum RR interval is identified and converted into heart rate. Okay, so before discussing this topic, I need to show you something. Okay, so you already know that to determine heart rate, we see the lead to. So P, QRST, again P, QRST, right? Again P, QRST in this way, right? So can you see that RR interval? If we measure RR interval, we measure the number of small square, right? We measure the number of small square, and to calculate heart rate, we just perform a simple calculation: 1500 divided by RR interval, right? 1500 divided by RR interval. But if you look carefully, the RR interval is not always the same. The classical way of determining heart rate is 1500 divided by RR interval in small squares. But if you look carefully, even if in lead to, so you will see that RR interval is not always same. Maybe here the number of small square is 15, and maybe here the number of small square will be 20. So heart rate varies. Okay, so heart rate usually varies, and this is called heart rate variability. And you know, this heart rate variability is a normal thing, right? Heart rate variability is a normal thing. Your heart rate cannot be fixed, right? So say right now your heart rate is 72, after a few minutes your heart rate is 80. So heart rate always it keeps on changing, right? So even in a single ECG, you may find that heart rate is somewhere 74, somewhere 72, right? And somewhere 80, even in a single ECG. If you continuously record the strip of lead to, RR interval varies. Okay, RR interval varies, and this is called heart rate variability. And why does this happen? This happens because the fighting, the conflict between your sympathetic system and your parasympathetic system, and this conflict is normal, quite normal in all healthy individual. Your sympathetic system and parasympathetic system, they keeps on changing, and once your sympathetic system is acting, your heart rate will be high, and your parasympathetic system is acting, your heart rate will be low. So there should be a balance, and once this balance is there, you maintain a fixed heart rate, right? So to perform this test, Make the subject lie down for 5 minutes, take lead to ECG for a period of 1 minute, and take the maximum and minimum error interval. Okay, nowadays all ECG equipments are already equipped with heart rate variability. You can connect it to the PC with the USB, and you can calculate heart rate variability, right? So how heart rate variability is calculated? So there are lots of parameters. With this, we can calculate the heart rate variability. So few parameters are like, So few parameters are like SDNN. What is SDNN? SDNN is simply the standard deviation of all the RR intervals. And another parameter is RMSSD. RMSSD is root mean of standard deviation of all the RR intervals, right? So take the lead to ECG, you take the or simply you can perform it by maximum RR interval max, RR max minus RR mean.
স্যার RMSSD রুট মিন হবে নাকি রুট মিন স্কোয়ার অফ স্ট্যান্ডার্ড ডেভিয়েশন?
Root mean square standard deviation.
হ্যাঁ তাই তো
Right.
বলছি।
Root mean square of standard deviation. Okay, so SDNN is simply standard deviation, RMSSD is root mean square of standard deviation, or simply you can perform the maximum RR interval minus minimum RR interval, right? And the more is the heart rate variability, the more the patient is healthy or your autonomic fibers are okay, right? So with the damage to autonomic fibers, and mostly parasympathetic fibers are damaged more commonly, for example, say a case of long standing diabetes mellitus, what happens, the parasympathetic fibers are damaged. So in this case of autonomic neuropathy, you will be seeing heart rate variability will be reducing with the progress of autonomic neuropathy, right? And autonomic neuropathy, in case of diabetic neuropathy, it is as the fibers affected are B fibers and C fibers, and as you know that B fibers and C fibers are either not myelinated or very least myelinated. It will be the axonal variety of neuropathy, but we can't test it directly whether it is autonomic or whether it is axonal or demyelinating, as because autonomic fibers are deep seated. Okay, now the next investigation. Okay, HRV clear, everyone?
Yes, sir.
Okay. Okay, there are a few other parameters for heart rate variabilities, like high frequency, low frequency. There are other ways of testing basal heart rate variability, but this is beyond our syllabus. We are not discussing. Just remember two parameters. One is SDNN, that is standard deviation of RR intervals, and RMSSD, root mean square of standard deviation, and RR max minus RR mean. These are the three parameters to measure heart rate variability. The more is the heart rate variability, the more healthy is your autonomic fibers. Okay, now the next investigation is 30:15 ratio, which is heart rate response to standing. So how to perform it? Ask the subject to lie supine for 5 minutes and ask to stand erect, unaided, that is without support or without help of your hands. Ask the subject to stand erect as quickly as possible while his lead to ECG is being recorded, right? So patient will be supine, connect the ECG lead. So ECG lead to ECG will be continuously being monitored while the patient is standing. It's not that you will remove the ECG cables or leads. Once the patient is standing, you will reattach, right? So don't do that. All the clips will be attached. This subject will be supine, and with all the ECG leads, patient will be standing, right? So this is the procedure. And the ratio is calculated as the ratio of maximum RR interval around which happens around 30th bit, right? Maximum RR interval. Maximum RR interval means minimum heart rate, right? Maximum RR interval means minimum heart rate, right? So the ratio is calculated as the maximum RR interval around 30th bit and minimum RR interval around 15th bit, right? So this is called 30:15 ratio. So the ratio is RR interval at 30th bit divided by RR interval at 15th bit. This is the ratio, right? And okay, and the ratio, normal ratio is more than 1.21. What is the mechanism? So once the patient is standing, gravitational pooling of blood in the lower extremity, decreased venous return and stroke volume, parareceptors will be less stimulated, and sympathetic system activity, so there will be tachycardia. So heart rate reaches maximum at 15th beat, then slows down to a stable at 30th bit, right? So 15th bit maximum heart rate, 30th bit stable and minimum heart rate, and the 30:15 ratio is a measure of parasympathetic function which decreases with age. Okay, normally it decreases with age, but once the patient is suffering from any kind of neuropathy, this progress is faster. Okay, any clarification needed for this test?
30:15 যেটা আছে না,
হুম,
ওটা স্যার 15th বিটটা তো পরে আসছে তো,
হ্যাঁ,
কারণ
15 বিটটা আগে আসবে, 30th টা পরে আসবে।
কেন স্যার? ট্যাকিকার্ডিয়া তো আগে হচ্ছে, তাহলে তো 30th বিটটা আগে আসবে।
After standing, ঠিক আছে,
হ্যাঁ,
after standing you start calculated, this is QRS complex, first beat, second beat, third beat, here standing, ठीक है, standing, and after standing you calculate beat, ठीक है, so dot first 15th beat and 30th beat, right? So take this and this, so RR interval here and RR interval here, correct? This is 1, 2, 3, 4, 5, 6 dot 15th bit,
আচ্ছা
and
আচ্ছা,
this
মানে
is 30 bit, correct?
আচ্ছা আচ্ছা, মানে প্রথমে 15টা বিট নেবো, তারপরে 30টা বিট নেবো।
হ্যাঁ, 15টা 15th বিট যখন হবে সেই সময় RR ইন্টারভাল ক্যালকুলেট করো, ঠিক আছে? 30th বিট যখন হবে তখন RR ইন্টারভাল ক্যালকুলেট করো, ঠিক আছে?
ওকে স্যার।
It is very easily done in a computerized ECG, ঠিক আছে? It's not the same ECG which you perform over here. It is not possible with this instrument. So once it is computerized, your computer already মানে tells you. So once the patient stands, you click the button starting, okay, and your machine tells you what is the 15th bit and what is the 30th bit, and your machine also tells you on your monitor that how much is the RR interval at 15th bit and how much is the RR interval at 30th bit. ওকে,
15 বিটটা যদি আমি কম্পিউটারাইজড মেশিন দিয়ে না করি তাহলে বুঝবো
তাহলে তো
কি?
করা যায়, খুব ডিফিকাল্ট, করা যায়, ডেফিনেটলি করা যায়। যেই মানে আমরা যে ইসিজি মেশিনটা দিয়ে পারফর্ম করি, দ্য ইসিজি মেশিন which we use over here, that simple radio type ECG machine without any computer connection, okay, so so just you need to put a mark with the pen immediately after standing, put a mark, okay, then up to 30th QRS complex you need to take out the print, right?
আচ্ছা,
But it's not easy, it's and once the patient stands there are some artifacts, right? So all these things are avoided once you put the ground electrode and you have an advanced ECG machine with HRV recording facility and also 30:50 recording facility, 30:15 recording facility. So simply measure the RR interval at 30th bit and RR interval at 15th bit, right? And the normal ratio is how much was the normal ratio? 1.21. Yes, 1.21 is the normal ratio, more than 1.21. So when it is less than 1.21, that means parasympathetic dysfunction. 30:15 ratio is more. It is a test for parasympathetic function, and it decreases with age. And once the patient is diabetic, this progress is more. Okay, so simply 30:15 ratio less than 1.04, that means your heart rate fails to decrease from 15th to 30th beat following standing. That means sympathetic overactivity, right? Sympathetic overactivity or some sympathetic overactivity, or also why sympathetic overactivity? Because of parasympathetic failure. parasympathetic failure, or better to use the term parasympathetic dysfunction. Okay, after performing this test, say for example, after performing test, you get that 30:15 ratio, 30:15 ratio is simply 1. Okay, 1.0, 30:15 ratio. That means your heart rate is not changing from 15th to 30th beat. So both ways heart rate is same, right? So that means very clearly there is no heart rate variability, right? Heart rate being same 13th to 15th beat, right? No postural change. That means parasympathetic fibers are damaged, right? Parasympathetic, or you can report as parasympathetic dysfunction. Okay, clear everyone?
Yes, sir.
Yes, sir.
এটা কি স্যার ওল্ড এজে হয়?
হ্যাঁ, ওল্ড এজে হয়, ওল্ড এজে ন্যাচারাল, ওল্ড এজে হয় 1.4 এর কাছে চলে আসে, বাট ওয়ান্স দ্য পেশেন্ট ইজ ডায়াবেটিক দিস প্রোগ্রেস ইজ মাচ মোর। Okay. Now Valsalva ratio. What is Valsalva ratio? It measures both your sympathetic and parasympathetic function. Parasympathetic function is for testing both afferent and efferent pathway, and sympathetic function part of efferent pathway is for sympathetic function. So Valsalva ratio, it assesses both sympathetic and parasympathetic function, but it is more for parasympathetic function. Okay, Valsalva ratio is for all practical purpose, for all clinical purpose. When we perform autonomic function testing, it is a test for simply it is a test for parasympathetic function. Okay, how to perform Valsalva maneuver? The patient is asked to sit in semi-recumbent position, and the patient is asked to blow air through a mouthpiece. Okay, blow air through a mouthpiece connected to a mercury manometer and maintain an expiratory pressure of 40 millimeter of mercury for 15 seconds. Remember this, this is convention. Okay, this is conventional to perform Valsalva maneuver. Okay, so patient is given a mouthpiece and patient blows into the mouthpiece, and patient is asked to maintain 40 millimeter of mercury pressure for a period of 15 seconds, right? Now the subject practices the procedure very well, and the test is performed thrice, allowing adequate time in between, and mean values are taken for result. ECG is monitored throughout the procedure. Okay, ECG is monitored throughout the procedure, and all the equipments like non-invasive blood pressure, heart rate, it is already attached with the patient, right? Okay, procedure, is the procedure clear to you? Patient will be asking to blow on a mouthpiece, and this mouthpiece is connected to a mercury manometer, and the patient might be the patient's maximum force maybe more than 40 millimeter of mercury, but conventionally patient is asked to maintain an expiratory pressure at 40 millimeter of mercury for 15 seconds, right? And throughout the procedure, patient's heart rate, blood pressure, ECG, everything is connected. All the wires are connected to the patient. Okay, so see, this is blood pressure curve. Okay, this is blood pressure curve, and this is heart rate curve, right? Blood pressure curve and heart rate curve. So you see there are four phases in Valsalva maneuver during that procedure. So we are asking the patient to maintain 40 millimeter of mercury for 15 seconds, and throughout the procedure we are recording all the parameters. So at phase 1 we will be explaining you know, what are the things happening in phase 1, phase 2, phase 3 and phase 4. But remember, most important is phase 2 and phase 4. In phase 1, due to straining, you know, you see blood pressure is increasing, right? In phase 1 blood pressure is increasing, then phase 2 decreasing, phase 2, yes, phase 2 decreasing, phase 3 is again decreasing, and phase 4 increasing. So this is the curve over here. So phase 1, this is the normal blood pressure. So starting of Valsalva maneuver, phase 1, then phase 2, then phase 3, and then phase 4. In this way, phase 4. In this way, it moves, right? So blood pressure changes in this way throughout the procedure of Valsalva maneuver, and this is the heart rate change curve. Okay, so this area corresponds to phase 2, right? And this area corresponds to phase 4. So what we need to measure? What you need to measure? The measurement is longest RR interval during phase 4. Okay, longest RR interval in phase 4 divided by shortest RR interval in phase 2. Okay, this is the measurement, right? Sorry. Yes. So as you see, heart rate is increasing in phase 2 and heart rate is low in phase 4, right? So this is around phase 2, this is phase 4. Okay, so during phase 2 and during phase 4, these two things are required, right? So longest RR interval, longest RR interval means longest RR interval, it is happening in phase 4 because heart rate is low in phase 4, and in phase 2 heart rate is high, right? Heart rate is high, that means RR interval is short. Here RR interval is high. So longest RR interval in phase 4 divided by shortest RR interval in phase 2, right? And this is the normal values. Normal is more than 1.45, borderline 1.2, minus 1.45, and abnormal is less than 1.2. So failure of heart rate to increase during strain. So once the patient is blowing and maintaining a pressure for 40 millimeter of mercury, so it is a strain. It is due to increased sympathetic activity, and failure of heart rate to decrease after strain release is due to parasympathetic activity. Okay, so straining is sympathetic activity, and after straining it is parasympathetic activity. So failure of heart rate to increase during the strain is due to sympathetic dysfunction, and failure of heart rate to decrease after the strain release is due to parasympathetic dysfunction. But with this ratio, Valsalva ratio, it mostly gives your parasympathetic system. So Valsalva ratio is more a measure of parasympathetic function than sympathetic function. So once it is less than 1.2, once this ratio is less than 1.2, it is called parasympathetic dysfunction, right? So for all practical purpose, for all clinical purpose, when Valsalva ratio is less than 1.2, it is called parasympathetic dysfunction, right? Clear, everyone?
Yes,
Any
sir.
response? Okay.
Yes, sir. Yes, sir.
Okay, I'll share the slide, no issues. Okay, now it is also given in your practical book, autonomic function test. Now expiration inspiration ratio. So what is expiration inspiration ratio? Subject is allowed to lie down for 5 minutes with ECG leads connected. Now ask the patient to take deep inspiration and expiration lasting for 5 seconds. Okay, so 5 seconds inspiration, 5 second expiration, right? So this is the thing the patient need to perform. 5 second inspiration, 5 second expiration. So total cycle is 10 seconds. That means 6 breaths per minute. This is what patient is performing. Okay, so ask the patient to lie down for 5 minutes with ECG leads connected. Patient is asked to take deep inspiration and expiration, each lasting for 5 seconds, and continuous ECG for lead 2 is being recorded. The ratio of the mean of 6 RR intervals during expiration and mean of 6 RR intervals during expiration is taken. Okay, so throughout this procedure, so this is, say for example, this is inspiration and this is expiration. This is inspiration and this is expiration, and now the ECG is being recorded, right? Here, and here also. So depending on the heart rate, patient's ECG is being recorded. Now you take 6 RR interval here, 6 RR interval. Okay, 6 RR interval you take here. It might be more than 6 within the duration of inspiration. So take all the 6 RR intervals and sum it and divide it by 6. right? So mean of 6 RR interval during inspiration and mean of 6 RR interval during expiration. This is what you need to take, right? So during the inspiration, take 6 RR intervals, sum it and divide it by 6. During the expiration, take 6 RR interval, right? 6 RR interval, sum it and divide it by 6. So you get the mean RR interval during inspiration and mean RR interval during expiration. So what to measure? Normal EI ratio is more than, so inspiration, expiration by inspiration. This is the ratio you need to calculate. And expiration by inspiration ratio, it should be more than 1.2 in the age group of 21 to 25, and it decreases with age. Inspiration, what is the physiological basis? Inspiration increases, yes.
ওই আগেরটা 6 কি করে আসছে 6 মানে প্রত্যেকটা ইন্সপিরেশনে 6টা কি করে আড়াই ইন্টারভ্যাল
ছটা নাও আসতে পারে, ছটা নাও আসতে পারে। সে দিস ইজ দ্য পিরিয়ড অফ ইন্সপিরেশন, ঠিক আছে, দিস ইজ দ্য পিরিয়ড অফ ইন্সপিরেশন এন্ড ইউ আর গেটিং লটস অফ RR ইন্টারভাল, রাইট? So it's this is 1 RR, 1 RR, 1 RR, ठीक है? So multiple RR intervals. So you take only 6, ठीक है? 1, 2, 3, 4, 5, 6. You take only 6. Sum it, sum all the RR intervals. Sorry, got deleted. ठीक है? So how many RR intervals are here? 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, so 9 RR intervals are here in a period of inspiration. So you don't take all the RR intervals. Okay, you just take 6. Okay, say for example 1, any 6 sequentially. Okay, 1, 2, 3, 4, 5, 6 RR interval. Okay, you add up all the things, R1 plus R2 plus R3 plus R4 plus R5 plus R6 divided by, all these are RR interval, divided by 6. So you get the mean RR interval during inspiration. So similarly, you take the mean RR interval during expiration and divide the mean of E expiration divided by the mean during inspiration. This is called EI ratio. Clear?
Okay, sir.
So inspiration increases and expiration decreases heart rate. Normally it happens. Inspiration increases your heart rate and expiration decreases your heart rate. This is called sinus arrhythmia, and it is absolutely normal, and it is mediated by parasympathetic innervation of your heart. So once your parasympathetic innervation to your heart, that means parasympathetic fibers are damaged, this EI ratio changes. Okay, heart rate response to deep breath is a classical example of parasympathetic function test. So this is particularly for parasympathetic function test. Normal EI ratio is more than 1.2. Okay, normal EI ratio more than 1.2. It should be more than 1.2. When it is less than 1.2, that means there is some indication of parasympathetic dysfunction or parasympathetic supply to your heart. Okay, that's it. So again, to sum, these are the tests. Yes, so these are 4 tests for sympathetic: postural challenge test, head up tilt test, sustained hand grip test, cold pressure test. Test for parasympathetic function is basal heart rate variability, Valsalva ratio, heart rate variability with respiration, EI ratio, and 30-15 ratio. And remember, these tests, particularly as because in many neuropathies, parasympathetic nerve fibers are easily damaged. That's why these tests are very much important. Okay, particularly heart rate variability, Valsalva ratio. These tests are very much important. We commonly perform heart rate variability to test autonomic fibers and particularly the parasympathetic fibers. And nowadays these tests are coming, but to perform these tests, we need high-end equipments, sympathetic skin response, quantitative pseudomotor action reflex test, and laser Doppler velocimetry for skin blood flow. So these are modern tests, upcoming tests, and high-end equipments are required for this. Just remember the names. You don't need to know the procedures.
So expiration heart rate টাকে বাড়িয়ে দিচ্ছে?
বলো কেন? Apply your common sense.
তো প্রেশারটা বেড়ে যাচ্ছে বলে, ইন্টারথোরাসিক প্রেশার বেড়ে যাচ্ছে বলে,
It is related to intrathoracic pressure.
ইন্টারথোরাসিক প্রেশার বেড়ে
Explanation will be related to intrathoracic pressure during inspiration. During
ইন্টারথোরাসিক
inspiration কি
প্রেশারটা
হবে?
তো কমে যাচ্ছে।
During inspiration কি হবে? Venous return বাড়বে না কমবে?
ভেনাস রিটার্ন বাড়বে স্যার, বাড়বে।
বাড়বে। এবার তুমি এক্সপ্লেন করতে পারবে।
স্যার ওখানে কি ভেনাস রিটার্ন বাড়ছে কারণ ওটা প্রেশারটা কমে যাচ্ছে, ওখানে ভ্যাকুয়াম
ভেনাস রিটার্ন বাড়লে কি হবে? ভেনাস রিটার্ন বাড়লে কি হবে? স্ট্রোক ভলিউম বাড়বে। স্ট্রোক ভলিউম বাড়লে কি হবে? মিন প্রেসার কি হবে?
প্রেশার বেড়ে যাবে।
মিন প্রেসার বাড়লে ব্যারোরিসেপ্টর কি হবে?
ব্যারোরিসেপ্টর
স্টিমুলেট হবে। সিম্প্যাথেটিক অ্যাক্টিভিটি বাড়বে না কমবে? সিম্প্যাথেটিক অ্যাক্টিভিটি কমবে, হার্ট রেট কমবে।
আচ্ছা
ঠিক আছে,
আচ্ছা আচ্ছা আচ্ছা।
ক্লিয়ার? তাহলে ইন্সপিরেশনে হার্ট রেট কমবে, এক্সপিরেশনে হার্ট রেট বাড়বে। দিস ইজ
এক্সপ্রেশনটা
নরমাল।
একবার এক্সপ্লেন করে দেবেন?
হ্যাঁ, সেম এক্সপিরেশনে সেম।
হ্যাঁ, কি হবে?
During inspiration, your intrathoracic vacuum increases. That means negative pressure. সেই কারণে কি হচ্ছে? ভেনাস রিটার্ন বাড়ছে, রাইট? ভেনাস রিটার্ন বাড়লে স্ট্রোক ভলিউম বাড়বে, কার্ডিয়াক আউটপুট বাড়বে, মিন আর্টেরিয়াল প্রেশার বাড়বে। মিন আর্টেরিয়াল প্রেশার is a stimulus for the baroreceptors. Now baroreceptors will be stimulated. Baroreceptors will try to restore mean arterial blood pressure. So in an attempt to restore, baroreceptor will decrease heart rate. Okay, opposite will be happening during expiration. Correct?
আচ্ছা ঠিক আছে।
Okay, students. So now for you, what to remember most importantly. Okay. It already, postural challenge test. It has already been discussed separately, right? Postural challenge test. It is already discussed as a separate practical topic. But the very important question I already told you, your examiner will ask you, what is the major drawback in performing postural challenge test? So remember, during active performance of postural challenge test, what is happening? As because your gastrocnemius and soleus muscles are exercising, the effective gravitational pulling of blood into the inferior extremity, it is not happening, right? So this should be your answer. And to overcome this, we need to perform table tilt test. To overcome this, we need to perform the table tilt test, right? So this is one important question. And with hand grip dynamometer, you need to do this practical once you come over here and our offline classes begins. Okay, and next what you need to remember, very important, is basal heart rate variability, valsalva ratio. All the things are important. Okay, all the things are important here. Particularly parasympathetic component is very commonly tested. Okay, because parasympathetic fibers are most commonly damaged. Again, diabetic neuropathy, parasympathetic fibers are damaged. Any stressful condition, parasympathetic fibers will be damaged. Sympathetic overactivity will be there, right? Clear? So just
Mainly
not in
দুটো
detail,
sympathetic
just
parasympathetic.
overview required. How to perform this test and what will be the abnormality? What is the expected outcome and what should be the abnormality, right?
Sir,
Yes, any question?
sir, test for parasympathetic component, এটাতে তো মানে sympathetic parasympathetic দুটোই কাজ করছে, মানে মেইনলি
But for yes, sympathetic parasympathetic দুটোই কাজ করছে, but for all practical purpose, we use these tests for parasympathetic component. Both sympathetic and parasympathetic are working, but it is more for parasympathetic component.
আচ্ছা আচ্ছা,
Correct. For all practical purpose, while performing this test, we consider that these tests are typically for parasympathetic test, for parasympathetic component. Correct. You don't need to write this practical into your practical manual. Just I don't think you will face any long question from this autonomic function test, but you will be asked in practical, what are autonomic function tests? Can you name it? So you need to enumerate what are the tests for sympathetic component and what are the tests for parasympathetic component, and maybe one or few tests will be asked. Okay. But the equipment which we are having in the department, you need to study those well, particularly, hand grip dynamometer, right? You need to perform this because this equipment might be kept in the spotting also, or you might be asked question on this also, hand grip dynamometer, right? Clear, everyone?
Yes, sir.
Should we finish?
Myself, Dr. Bilash Sarkar, Assistant Professor of your college, now going to take a class on vitamins. Okay.
Sir.
Am I audible to you, all of you?
Yes, sir.
Yes, sir.
Yes, sir.
Okay. What is your opinion or what do you know about vitamin? Can you tell me, anyone of you? As a first, okay, no problem. First, I'm coming how vitamin was discovered. Do you know scurvy or ricket or beriberi? Have you any idea about scurvy, ricket, and beriberi?
Sir, they are deficiency diseases caused due to the deficiency of certain vitamins.
Okay, that's why we have searched for some molecules which are responsible for this scurvy, ricket, and beriberi. Okay. In search of that deficiency manifestation of scurvy, ricket, and beriberi disease, vitamin theory was suggested by Hopkins in 1912. Okay. In that time, it was found it was thought that some vital amines are important for this manifestation. That's are known as vitamin. That time, vitamin. The term vitamin was coined from the term vital amines. Later on, it was seen that vital amines contains no amine group. That's why the term has vitamin VITAMIN, not E. Okay. Okay.
Yes, sir.
Yes, sir.
Next, definition of vitamin. Vitamins are organic compounds occurring in natural foods in small quantity and essential for growth and maintaining good health in animals. The term was coined by scientist Hopkins, and was awarded Nobel Prize in 1929. Do you know how many types of vitamin is present? Hello, anyone? Please respond. Hello? Do you know types of vitamin?
So types as in your, do you want to know the examples or?
No. Types, broad spectrum.
So water soluble and fat soluble.
Okay.
Fat soluble and water
Which
soluble.
one
Water
are-
soluble like ADEK.
Okay, and water soluble
Vitamin
B
B complex
complexes.
is
B complex.
and vitamin C. So what are the difference between the two groups? Do you know?
Sir?
First one is fat soluble and water soluble. Then fat soluble can be stored in body. Second one, water soluble cannot be stored in body. As fat soluble can be stored in body, so deficiency is less common than the water soluble, which cannot be stored in the body. Okay. Hello.
Yes,
Okay,
sir,
please
you're
go
audible.
through-
Sir, you're audible.
Yes. Please go through the book for differences. Next, I am coming to the main topic of vitamin A. This is mainly our part of discussion today. Vitamin A is a fat soluble vitamin. Mainly, it is It is produced from the provitamin, beta carotene of plant tissues. Okay, beta carotene has two groups. I cannot share with you. That's why I cannot. I have failed to see the structure of beta carotene. Okay, beta carotene has two beta ion rings connected by a polyphenol chain. Theoretically, one molecule of beta carotene can give rise to two molecules of vitamin A, but in biological system, one molecule of vitamin A is produced from one molecule of provitamin beta carotene. Next, I am coming to sources of vitamin A. Sources of vitamin A can be divided into two groups. One is animal sources, another is plant sources. Animal sources are liver, meat, egg, milk, butter, and fish. Fish is the most richest source of vitamin A of animal origin. Next, I am coming to the sources of vitamin A of plant origin. Green leafy vegetables and yellow fruits like mango, carrot, pumpkin, papaya, etc. are the sources of vitamin A in the form of beta carotene. Okay. Do you know how many types of vitamin A is present in our body? Hello? Hello?
Sir, could you repeat the question?
How many types of vitamin A is present in our body? Or what are the forms of vitamin A in our body? Okay, no problem. All compounds with vitamin A activity is known as retinoids. Retinoids are polyisoprenoid compound having beta-alanine ring. There are three forms of vitamin A present in our body. They are retinol, and retinoic acid. Retinol can be converted into retinol or retinoic acid by the enzyme retinal reductase. Retinol can be also converted to retinal. Okay. The side chain of vitamin A contains alternate double bond, so many isomers of vitamin A can be occur. But most common form of vitamin A is present in our body is all trans retinal, which is also known as vitamin A. Another biological important form of vitamin A is cis retinal, which is also known as vitamin A2. What is difference between the all trans retinal and cis retinal? There is in case of cis retinal, there is an extra double bond in case of in position 11. Okay, can you understand what is the basic difference between all trans retinal and the cis retinal? Hello, please response.
Configuration maybe.
Configuration: one extra double bond is present in case of cis retinal at position 11. Okay. The rest are same in case of all trans retinal and the cis retinal. In case of cis retinal, there is an extra double bond at position 11. Okay. Have you understand or not? Hello?
Yes, sir. Yes, sir.
Yes, sir.
Okay. Next, I am coming to absorption and transport of vitamin A. How from vitamin A is absorbed? Do you know?
Intestine.
Intestine. Okay. Absorption occurs at intestinal mucosa. Beta carotene at intestinal mucosa is kept by dioxygenase enzyme to form retinal at mucosal cells. Retinal is reduced to retinol by NADP or NADPase by the enzyme retinal reductase and absorbed along with other fats like chylomicron. Okay. Within the mucosal cells, retinol is deesterified with the fatty acid and transported to liver and stored as retinal content in the liver. From the liver, vitamin A is transported to the peripheral tissues as all transretinal by retinal binding protein or RBP. Retinol and retinol binding protein complex bind to the specific receptor present on the peripheral tissues like retina, gonad, and iris. And this retinol enters into the cell. Within the cells, the retinol binds with the retinoic acid binding protein, and finally, binds to the hormone responsive unit of the DNA and gene gets activated. I cannot share with you the slide which I. Okay. Next, I am coming to the function of vitamin A. What is the main function of vitamin A in our body? Can you tell me?
Vitamin A is required for good vision.
Cannot hear you. Please.
Eyes, because rods and cones, rod cell contains retinal, which is a component of retinol, that is vitamin A.
Main function of vitamin A is in our body is the vision, to help in vision. Okay.
Vision.
Agree? Agree or not?
Yes, sir.
Okay. Another function of regulation of gene expression and tissue differentiation. Vitamin A also acts as antioxidant and anti-inflammatory property. Vitamin A also acts like steroid hormones and helps in growth. Beta carotene prevents heart attack. Vitamin A is important for maintenance of normal epithelium and skin. Normal epithelium of skin. Okay. Next, I am coming to the most important part. That is visual cycle. It is important for your exam. Suppose you have to get this visual cycle. Okay. Hello?
Yes, sir. Continue. Audible, sir.
Yes, visual cycle, it is essential for our daily life. George Walt was awarded Nobel Prize in 1967 in identifying the role of vitamin A in vision. What is the pigment responsible for vision? Do you know?
Rhodopsin.
Rhodopsin. Why it is present?
Not cells.
Rods, not cones. Rhodopsin, a membrane protein of photoreceptor cells, plays pivotal role in vision. It is made up of opsin, protein opsin, and 11-cis retinal form of vitamin A. This rhodopsin is in retina, it is inactive form. Next, rhodopsin are G protein coupled receptors, and 11-cis retinal locks the receptor protein opsin in active form. When light falls on the retina, 11-cis retinal isomerase to all trans retinal through a number of intermediate products. Do you know what are the intermediate products for this conversion? That is beta-rhodopsin, lumirhodopsin, meta-rhodopsin 1, meta-rhodopsin 2. Okay. This isomerization and photoexcitation leads to activation of G protein and generation of cyclic GMP, which produces nerve impulse through cation-specific channels. The nerve impulse thus generated in the retina is transmitted to the visual cortex of brain, and the image is captured by brain. That is how we can see an object. Okay. After dissociation, opsin remains in the retina, and the all transretinal enters into the blood circulation. In the retinal, all transretinal isomerase to 11-cis retinal and binds with opsin to form rhodopsin, or it is transported to liver where it is converted to 11-cis retinal, and after that it is transported to retina to bind with the opsin to form rhodopsin. In this way, the world's visual cycle is completed. Okay. Do you know the daily requirements of vitamin A? What is RD? Hello? 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 Hello. The daily requirements of vitamin A for children it is 400 to 600 microgram per day. For men it is 750 to 1000 microgram per day, and for women it is 750 to 100 microgram per day. What are the causes of deficiency of vitamin A? Deficiency of vitamin A occurs due to reduced intake, reduced absorption in malabsorption syndrome, increased excretion, increased demand as in pregnancy, or in zinc deficiency. Deficiency manifestation of vitamin A, that is called first and foremost is the actopia or night blindness. Second one is xerophthalmia. Third one is bitter-spot. Then keratomalacia, preventable blindness, follicular hyperkeratosis, and acne. What is xerophthalmia? Xerophthalmia it occurs due to vitamin A deficiency. The lacrimal gland becomes keratinized and stops secreting lacrimal fluid. So the eye becomes dry, thick, and keratinized. And cornea becomes lusterless and its transparency, normal transparency is reduced. Then it is bitter spot. It is a yellow triangular yellow plaque present on the sclera adherent to the sclera of eye. Next, keratomalacia. When xerophthalmia persists for a long time, the cornea is softened, it is degenerated and gets infected, and ulcer is formed, and total blindness occurs in case of keratomalacia. Next, follicular hyperkeratosis. The skin becomes rough and around the hair follicles. Hello? Hello?
Yes, sir, we can hear you.
Next, I am coming to hypervitaminosis of vitamin A. Hypervitaminosis of vitamin A rarely occurs. When it occurs, when large amount doses of vitamin A are taken over a long-term period, it mainly occurs in children or in elderly people. What are the signs and symptoms of hypervitaminosis? Hypervitaminosis of vitamin A leads to anorexia, irritability, headache, peeling of skin, drowsiness, and vomiting, enlarged liver, and plus cell death. Okay, now I am coming to therapeutic use of vitamin A. Vitamin A is used in case of night blindness for preventive measures. The supplementation is given in the form of capsule or injection. The recommended dose is 20 to 50 times of recommended daily allowance. Okay, trans-retinoic acid is used as an adjuvant therapy.
স্যার কিছু বোঝা যাচ্ছে না স্যার
Hello? Hello?
স্যার we are not able to understand what you are saying.
Cannot understand?
No sir.
Can you hear me?
We can only hear you sir but not understand what you are saying.
The therapeutic uses of vitamin A. I am telling about the therapeutic uses of vitamin A. Okay. In what purpose we use the vitamin A? It is used in case of night blindness. Okay. The trans-retinoic acid is used in promyelocytic leukemia. Another use of vitamin E is synthetic retinoid isoretinoid, which is used in acne treatment. Have you heard the name of acne? Hello? Hello?
Yes, sir.
What is acne?
Sir, we can't hear your voice, sir, properly.
Properly cannot hear.
No, sir, it's
Okay, that's
like
the problem.
repetitions in your voice.
Huh?
Repetitions in your voice.
Okay. That's the problem. But that's why you cannot understand. Hello? Hello?
Hello.
Can you tell me why cats and dogs or owl can see at night? Hello?
Yes, sir.
Sir, why cat, dogs, owl can see at night? What is the basic reason for that?
Rods and cones absent.
Huh?
Rods and cones absent.
Absolutely, why they can see at night?
Who can't see at night?
Cats.
Cats.
Phone absent, but not present.
Why? They can see at night?
Because, sir, we have rods. Rods.
But why they can see? I cannot asking about us. We cannot see at night because of rod.
Maybe either of the two rods and cones which are acting. That's why.
No. Rods is rod cell is responsible for dim light vision. Okay.
Cells have more rod cells than the humans.
Yes, that's the correct answer. Another question is why when we enter the cinema hall we cannot see. What is the basic reason? Give me the answer.
When we enter the cinema, we cannot see.
Why? After some time we can see. What is the basic reason?
Sir, because as we are going
It takes time to adjust.
Yes, sir.
Dark adaptation time. Okay, that is called the dark adaptation time. Okay. Thank you all for and cooperation. Okay.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Okay.
Thank you, sir.